great pleasure to welcome you to the 16th edition of School of Tomorrow events, Guardians of the Future, Shaping Tomorrow with Generative AI. The non-profit School of Tomorrow event series was launched by Beacon House in the year 2000 to engage global communities in conversations that shape the future of schools and societies. I would like to thank Google for Education and their partner Tech Valley, the lead sponsor for School of Tomorrow 2023, and our titanium sponsor, United Bank Limited. Other key sponsors include My Backpack, MK Books International, Allied Bank Limited, Habib Bank Limited, Watheen, and Interwood. We also thank our School of Tomorrow supporters, including Paramount Books and Nestle Pure Life, who have contributed to this year's event. My name is Mohammad Qasim Rahman, and I am an IGCSE and A-Levels mathematics teacher at Beacon House, Poroha campus, Islamabad. Please take a moment to note these important housekeeping points. Please ensure your cell phones are on silent. In case of an emergency, the exit point is located at the back of this hall. You may use the staircase opposite to this hall. In case if it is blocked or packed, you may use the one on the right-hand side. Always stay calm and follow directions. Please use the SOT app to scan the QR code for session question and answer and feedback. Share your thoughts on social media using the hashtag Guardians of the Future and hashtag SOT2023. If you need assistance, our ushers are here to help. For questions, please either use the flashcards provided by the ushers or the mobile app. The panel discussion will last for about 45 minutes, followed by 15 minutes for question and answers. I would like to invite the moderator of the session, Ms. Nergis Heather, on the stage and introduce the panelists. Ms. Nergis Heather. Ms. Nergis Heather, Deputy Head Middle School at the Beacon House campus, has a rich experience of teacher training and curriculum implementation. Previously, she served as the Regional Senior Manager Training South and completed various international courses and certifications in early childhood education, special education needs, technology in education, project-based learning, and teacher development through coaching and mentoring. She's also an accredited program leader for Cambridge University diplomas in teaching and learning.
Thank you. Good evening, everyone. So, breaking new ground in Pakistan, SOT 16 2023 proudly introduces AI avatars, first time in a conference. Digital panelists powered by cutting-edge artificial intelligence. These AI avatars will participate in our discussion throughout the 3-day event, showcasing their ability to engage in conversations and respond to questions with human-like precision and nuance. I can't promise the last part, but I'll give it a try. Okay, and now I'd like to introduce my panelists. Dr. Fahad Umar is associated with the Department of Surgery at the Aga Khan University Hospital as assistant professor in the Operative Dentistry and Endodontics program. He's an academic editor for PLOS ONE and serves on the scientific committee of Journal of Endodontics and International Endodontic Journal. He's also an active member of ITU WHO focus group on AI in health, group dental diagnostics, and digital dentistry. Let us welcome Dr. Fahad Umar. Dr. Sara Saeed Khurram, who is joining us online from the UAE. She's our online speaker and expert, who is the founder of Sehat Kahani. Dr. Sara is a digital health, Sehat Kahani is a digital healthcare platform in Pakistan and has over 8 years of experience in the field. She has also worked in micro-health insurance and community healthcare initiatives with USAID. She has been presented with the Heroine of Healthcare Award 2022 by Women in Global Health Forum. Stuart Weitzman Bold Move Award, VM Power Award, the Rolex Award as Associate Laureate, CRDF Global Awards, Ashoka Changemakers, ISIF Asia, the Unilever Sustainable Living Young Entrepreneurs Award, and the UNICEF Global Goal Campaigner Award, and Arpitec Young Entrepreneurs Award. So a very warm welcome to Dr. Sara. Thank you very much for joining us. And Dr. Saulat Fatmi, who is the head of cardiothoracic surgery at the Khan Hospital in Karachi, and he's a certified general surgeon and cardiothoracic surgeon at the Khan Hospital. He's also a graduate from the Khan University and completed his general surgery training at the University of Tennessee in Memphis, and his fellowship in cardiothoracic surgery at St. Louis University Hospital, Missouri. He's also the inventor of beating heart simulator with a US patent, and a member of American Society of Thoracic Surgeons, the American College of Surgeons, and the Pakistan Cardiac Society. Please give a big round of applause to Dr. Saulat. He's a well-known surgeon in his field, so it's an honor for us to have you, sir. Thank you. So now let us begin this session. Since morning, we have been talking about AI, and this particular session focuses on AI in healthcare. So we have Dr. Saulat, who is not too sure if it's going to happen. And we have Dr. Fahad, who promotes AI in healthcare. And we have Dr. Sara Saeed, whose platform is a type of AI in healthcare. So I would like each one of my panelists to begin by introducing what they think AI will do in healthcare. But before we do that, I also need to introduce our AI panelist, Samir, who will also share some insights with us today, hopefully. So let's begin with Dr. Fahad.
Thank you very much for inviting me here. And I'm very excited to talk in front of you. I think it's a vibrant crowd. And a round of applause for you guys. It's almost the end of the day, and it's a full house. Very well done. Personally, I'm just going to give you a little bit of insight of myself and where I come from, other than the introduction. So there's been a lot of talk about digitization as well as AI. And the classrooms are changing, and the digital classrooms are coming in, and they're more inclusive. I haven't really had any formal educations in AI. I was actually really an AI enthusiast. And all my learnings of AI have come through the digital platforms, such as YouTube, and having access to open access browsers, as well as open access tools that I leveraged to train my AI algorithms and learn AI a little bit more. So I'm not an AI expert, I'm an AI enthusiast. So as far as AI in healthcare is concerned, I think it's already here. And there are a lot of AI-related algorithms which are available to us. So what I've noticed, and AI has been, or is going to be disruptive technology. And just to give a little bit of a definition around what a disruptive technology is the way people think, or businesses operate, or people work around different problems. If they change the way they do it, it's known as a disruptive technology. And the latest disruptive technology that we had in the recent past has been the internet. And I think AI is probably either the new internet or the electricity which is coming in. And this puts us in a really unique position in a way, because when you look at different kind of technologies from the internet that came about, say YouTube, eBay, etc., they've come in from the global north. So mostly the Western countries participated in this transition and in this revolution, and we as a third world just contributed to the consumer effect of that. With AI in health, we are sort of in a unique position, because AI is based on healthcare data, and data is unique to different areas and different demographics. And so we, as a low-income country, are placed in a unique area in which we can actually be sort of like together or move together with the high-income countries in leveraging AI health algorithms within the population. So what that means is, if high-income countries have algorithms which are or trained AIs which have been trained on data which is their own, it doesn't really work in our part of the world. So we as a developing field, we have a lot to contribute. So that's my take on it, and that's why we need to prepare the younger generation how we can contribute to this new development, so that the MacBooks or iPhones that has come in from the north actually come in from our part of the world. Thank you.
Thank you, Dr. Fahad. That was really interesting. Dr. Solat, now I'd like you to not just tell us about AI, but how do you see the change in heart procedures, since you are a cardiothoracic surgeon? So in your field, how do you see the impact of AI?
So I'm sold out on AI. So though I grew up at the time when the computer was being invented, but I'm actually sold out on AI. Now let me give you 3 examples how the AI has affected my part of the field. First is, you guys must have heard about that out of 100 people, whenever the first time they get a heart attack, 50 of them, they just don't survive. Only 50 people go to the ERs and cath labs, and then they get the angioplasty or a bypass or medical treatment. So over the years, people had tried to figure out how to find those people who are at risk of a heart attack. So they have come up with lipid profiles, fasting blood sugars, but they came up with one thing which is AI-based, which is calcium scoring on the CT scan. You get the CT scan, you get the calcium scoring on the heart, not the coronary angiogram, it's a 5-minute procedure. It gives you a scoring. And that scoring determines whether the person has a very high likelihood to have a coronary artery disease and will have a heart attack sooner or later. So that's one example that has changed the way people are looking at heart attacks, even in our part of the world. US mein to hai, yahan bhi. So that's number 1. Number 2 is, we have introduced the AI system at AKU. We are using the CT scan, but we are using another one. We noticed that when kids are in the ICU and they had an open heart surgery, sometimes they are very, very sick. So by the time they get to the certain point where they are almost, the blood pressures are going down or the heart rates are going down or they're not doing very well, is at the time when the nurses tell you or the doctors get to know it, and by that time it's too difficult to reverse that action. So we have put in an AI tool which tells us 12 hours in advance that this patient is not going to do well in 12 hours. So try to take that any kind of steps if you can. That's the second thing that we are implementing as an AI. And the third thing is, all of you get ECGs, okay? So in Mayo Clinic, a few years ago, there was this cardiologist, the head of cardiology at Mayo Clinic. He said that we have all these patients with heart failure. They're actually, the heart failure patients are millions of them who are walking around all over the world, millions of them, and they do not know that their heart functions are down. So how do you diagnose them? You can't get an echo on all of them, you can't get the angiographies. What do? So what he did was he studied a lot of ECGs, okay, a simple ECG, and he studied a lot of ECGs. And they put them in the machines. And it came up with an AI, with the algorithms, they came up with an AI plan that the AI will be able to figure out, looking at those ECGs, that this patient's heart is actually not as functional as normal, And it can also predict that this person's heart will actually not be doing good in the next 4 years. So this you can look it up on the internet about this, what I'm telling you about. So that has changed, revolutionized how cardiac patients are being seen. As far as the cardiac surgery specifics are concerned, we have robotics, which can go into certain places where a human hand can't dissect or can't put in a suture there. The robot can go in, and that's also AI generated. Having said all of this, so the AI has definitely improved our lives, improved the diagnosis, treatment, and everything. My own personal opinion is it cannot let that humanistic touch go, ever. Because as far as all of us look around us, we like to have relationships. We like to love, hate, jealousy, liking somebody, those human relations. That defines our soul. And I don't want to be philosophical, but that is what defines human beings. As a robot, they may not be able to do all of this, but they will help us spend more time into all of this, because then we will not be worried about trying to do things which we could have done better if we had that knowledge. So the AI tells us that knowledge, gives us the knowledge, and then we could be able to do it. So I think AI is going to stay here in healthcare. It's going to be more and more, and it's going to make your lives even better. And I think that's what we should just continue with, embracing it.
Thank you very much, Dr. Solat. Very interesting insight. Dr. Sara, since you have created a one-of-a-kind platform that is accessible to all kinds of people in all walks of life, so please give us your views on AI in healthcare. Okay, while we are waiting for Dr. Sara, let me introduce our AI panelist. Please allow me to introduce our digital panelist, Samir. He's right here. And he will participate in this discussion. So let me try asking him a question while Dr. Sara, please. I hope he does say something. Samir, please tell us if AI will replace doctors.
Hi there. I'm Samir, an AI avatar panelist for School of Tomorrow events. How can I assist you today?
Will artificial intelligence replace doctors? Let's wait for Samir.
Don't worry, till that time we are here.
Will artificial intelligence replace doctors?
AI has the potential to revolutionize healthcare by assisting doctors in tasks like diagnosis and treatment. However, human doctors bring empathy, intuition, and critical thinking that AI cannot fully replicate. It is more likely that AI will complement and enhance the work of doctors rather than replace them entirely.
Thank you, Samir. So he has actually validated what Dr. Solat just said. All right. In the meantime, I'll just pose the questions to Dr. Solat and Dr. Fahad. Thankfully, we have face-to-face panelists. So no replacement for that. So, Dr. Solat, my next question to you is, how is artificial intelligence augmenting diagnostic accuracy and patient outcomes?
In terms of diagnosis, now remember, there are lots of labs that one does, and there's a lot of angiographies and all of this. So I can tell you about the cardiology, cardiac surgery. In cardiac surgery, in human beings, when somebody is having a heart attack, okay, somebody's having a heart attack. The coronary arteries may or may not be blocked. It might just come out as a shock to some of you, but that is a fact that coronary arteries may not be blocked because the plaques that are formed in coronary arteries are actually, some of them are soft plaques, and they break and they create platelet aggregation, and then the patients just have a heart attack and then they just go away. Remember, 1 out of 2 people just go away. So we want to save those 1 out of 2 people as well as the second 2 out of 2. So what artificial intelligence now is doing is, I'm just going to give you a very simple example. What cardiologists are doing is they are taking the intravascular ultrasound going into coronary arteries of all patients, and they are putting that data into AI. The AI will be able to predict that this coronary artery plaque, though it's not blocked, you don't need an angioplasty at that time, it looks like almost normal by human eye, but they're able to look at that plaque, able to judge it and say that this
When you
plaque
want
will
to sort
rupture
out
in
your
the
max
next
once and for all,
5
what
weeks
do you
or
do?
1 year.
Most tips
So
from the
why don't
internet
we
didn't
have
work.
an intervention
We tried
right now
emptying
on
the-
that soft plaque rather than doing it later? So that's one diagnostic thing. I'm just going to give you that example. Apart from that, there are numerous examples that actually helps us diagnose patients and stuff like that. There are algorithms now in AI where, especially in radiology, when you have a radiology, let's say you get a chest X-ray, the radiologist reads it, but it's a human being reading it, and he is not, obviously he has had an experience of 10 years, 20 years, 30 years, but he has a limited knowledge of seeing those X-rays. What about an AI which has read 30 million of those X-rays, has put that into the knowledge, and then is able to diagnose that this has a nodule or not? I can give you an example. My aunt had, on an X-ray, had a small lung nodule on an immigration visa. It was not picked. It was a very small one. The radiologist didn't pick it. 2 years later, when she started coughing and having problems, then it was picked up because it was bigger. If the AI was there, it would have easily been able to pick that little nodule. So X-rays are, radiology is one. Then there is microbiology, where people look at certain, under the microscope, the pathology. They look at it in the microscope and then figure it out what kind of a tumor you would have, or what other disease you have. The pathologist, the biopsies. And the AI will also revolutionize that part. So the radiology, pathology, lab tests, it's going to help us. Now, how you use that to treat will be the redefining our doctor. That's what the new or the school of tomorrow, instead of school of tomorrow, the medicine of tomorrow will come in.
Thank you, Dr. Solat. So, Dr. Fahad, now my question to you. Are future healthcare professionals being prepared to incorporate AI into their education and training?
So at this point in time, the curriculum doesn't include that, but people are certainly thinking about it. And from my perspective, what we're doing is we're first giving them a taste of incorporating AI and bringing them into the teaching area as well. Because being a part of an academic medical center, we don't just impart clinical training, we also do educational work. So, and it'd be redundant to tell you about the 2 sigma effect of the Benjamin Bloom's theory of limited resources that we have. But with using AI and giving them a feeler of the AI, we are able to give them personalized academic experiences. Likewise, there have been conversations around how we could include AI within the curriculum and also bring that into the exam system. It will catch on. We're not there yet.
Thank you, Dr. Fahad. So now, Dr. Sara, hopefully we can hear you. So please give us your views.
Housekeeping question once again. Can you hear me?
Yes. So how do you think artificial intelligence will impact healthcare?
See, I think I'll start from a little bit of my personal journey, just giving you a little bit of context how I landed into digital healthcare. As one of the panelists said, he's a digital enthusiast. I think I'm a digital healthcare learner because I've studied medicine as my primary degree, and I created Sehat Kahani primarily to fix the problem of doctor brides in the country. To reintegrate women doctors back from their homes and connect them to patients, if not physically, then virtually. And through this, we started creating nurse-led telemedicine clinics in low-income areas, so far off areas where doctors don't reach, in villages, in low-income communities where doctors are not available for 100 kilometers. We upgrade community midwife or lady healthcare visitor clinics into a telemedicine clinic, giving them a software, e-tools, a prescription printer, and a small closet pharmacy. Now, in doing that, we were able to connect a patient to an online doctor. And while this was one motivation, and we started working in these communities, we realized that Pakistan also suffers from a bigger healthcare problem, which is because a lot of women doctors don't work and a lot of male doctors go out of the country for better work opportunities. Pakistan, unfortunately, is left with half a doctor for 1,000 patients, most of these doctors working in the urban areas. So we realized that the problem that we were solving was much more bigger than just the doctor bride phenomena. It was to provide quality, affordable, and accessible healthcare to all using technology, and that's what the mission of the company now is. We started by making clinics in low-income areas, but as COVID came in, I think that just disrupted health technology everywhere. And Sehat Kahani also took advantage of that and launched an application for the masses that allowed anyone with a smartphone to download an app and connect to a doctor and talk to a doctor on a chat, audio, and video consultation. Over time, we've connected our patients to online diagnostics, pharmacy, and connect them to doctors by appointment and also instantly using the 60-second option. Now, in doing all that, we started gathering a lot of data. And as an entrepreneur, I think for me, a solution is unlocking a box of puzzles. So once you unlock one puzzle, then you find the solution to the next puzzle that is in front of you. So it's like a treasure hunt. So as we started collecting all this data, we realized that now we can actually standardize how doctors can see patients for certain symptoms that are available in our population. So we took the first 30 symptoms that were coming again and again on our application, and we created a clinical decision support system that allows a doctor to ask a set of questions that helps them to create a diagnosis and also a treatment plan. Right now, obviously, the treatment plan is pre-fed into the system, but we see in the future that this treatment plan or the diagnosis can be predictive or suggested as well. Now, what it did was, within our platform that was just a doctor-patient connecting platform, it suddenly became a platform that became an efficient tool for the doctors to do standardized consultations, whether they were seeing a patient in a rural area or an urban setting. We later on used some of these data sets on some of these diseases, and 3 of those diseases that we're working on right now is diabetes, it's cardiac diseases, and it's mental health. And we're actually seeing that the patients who've come on our platform in the last 1 or 2 years and have done more than 3 consultations on the same disease, and they're known case of a certain disease, for example, cardiology or diabetes or mental health, we can actually send them preventive healthcare reminders. We can sell them personalized messaging. We can ask them to follow up. And that will create a chain in not only their continuity of care, but also changing the quality of life that they're beginning. We are also now using these data sets to make sure that we're saving the doctor's time by creating a telemedicine assistant. So right now, of course, we have done 2.5 million consultations, but over time, we're seeing more stickiness on the platform. One patient who was doing 1 consultation 3 times a year now is coming back and doing 7 consultations in the same year. So over time, as digital health technology intervenes in a country like Pakistan, we're going to see much more patients reaching out to online doctors, and then we're going to have a problem where there'll be lesser doctors and more patients. And that's when the chatbot or the assistant will be helpful in creating a list of questions that can diagnose or do an initial screening of the patient, save the time of the doctor, and really help a lot of patients to get to the right doctor, to get to the right referral, to maybe seek an emergency, so not go to the telemedicine doctor at all and go to the tertiary care hospital because they need one. And so many other scenarios can be created. But I think for us, it is more at the stage of machine learning and making sure that we are using that data for technology.
Thank you, Dr. Sara. That was very useful. So now my question to all three of you, actually. Pakistan is currently facing the climate crisis. And in this crisis, many parts of Pakistan were cut off due to flooding, landsliding, and many other natural disasters. So how can AI facilitate healthcare workers to connect with the affected people in these areas?
Well, I think one way of doing it is to bring the digital clinic to them, right? So I think, and Sarah would be the best person to talk about that because of her background in that. But yes, you could potentially do screenings using mobile phones. And for example, right now what we're doing is we're doing a project in which we're doing dental health screenings and training an algorithm which is doing dental health screening based on AI algorithms. So what you could essentially do is, right now we have a less amount of dental healthcare providers who are available within the rural population. We have more dental healthcare providers in the urban population. And you need to have a certain degree of skill set to recognize disease. Unfortunately, we don't have that kind of a human resource that is trained. But we do have lady health workers who are already trained, who are already there, right? And with that idea, we started developing an algorithm in which the algorithm has been trained on data that we've already accumulated from those areas. We've demarcated different kinds of diseases that are there. And this can empower the lady health worker with their mobile phone. If they have an AI-based app on their phone, they can just basically take pictures of the intraoral region. They don't have to document anything, just put in the demographic data and it goes on to the dashboard. And the dashboard gets updated, so the dental healthcare providers as well as policy makers know the disease prevalence in that particular area. And that way they can make health interventions accordingly. So that's one way of democratizing health to the rural population.
Thank you, Dr. Fahad. So my question to you, Dr. Solat, like I already discussed with you. So will there be a minority report of disease diagnosis?
So yes, there will be. When a child is born, when he's 10 years old, and this has been proven, at a time when most of you were not even born. So since then, it's been proven that when a child is about 10 years old, they have these plaques which form in the aorta, the big vessels. And they can also, from that point, they can determine whether the person is going to develop atherosclerotic disease or not. So the AI, the way that AI is going, the data which is being fed in with considering the genetic makeup, the propensity or the predisposition to cardiac diseases, looking at their family histories and everything. When a child is born, maybe at that point in time, one can determine that this boy is going to have a heart attack at the age of 52. He's going to have diabetes at the age of 63, and the person is going to have it at that point in time. It's already in place. The genome has already been taken care of. So it's just a matter of time. A child will be born, and you will be able to get a whole certificate saying what is going to happen in the next few years in terms of at least health.
Thank you, Dr. Solat. That was extremely interesting information. So my next question is that I would like each one of you to comment on the ethical issues that surround artificial intelligence and patient data. Yes, Dr. Fahad and then Dr. Sara.
With that, so I mean there are quite a few issues around this, and to begin with is patient data. So data is the new oil. That's what we're talking about. So who does the data belong to? Does it belong to the patient? So imagine a situation in which you go to your clinic, get your x-rays done, and then there's an AI algorithm which trains on your x-ray. So your input would be, would that be consensual, or is there no consent involved? Does the consent form include some language about whether this x-ray is going to end up in training an AI algorithm? And when that is being done, another thing that may actually put you as a disadvantage is that there are chances that there may be leakage of some metadata, which means demographics, age, gender, etc., that can go out. And in an insurance-based environment, that's something that people are very reluctant to leak out, because imagine a scenario in which the insurance company gets a hold of your x-rays and then fails not to insure you because your data was leaked somehow. So that's one aspect of looking at it. The other ethical domain that is a problem and will come up eventually is, imagine a situation in which we are living in the world of AI, right? And AI makes a decision of disease versus non-disease and says, okay, this thing is diseased. And then the healthcare provider, who may not be so much into the diagnostic processes itself, may find it difficult to challenge the result that was put up with the AI. So how do we deal with this situation? If there's a wrong treatment that was done based on a judgment that was based on AI, who is held accountable? So this is a whole Pandora box of different kinds of challenges that are coming in. Another challenge that us researchers are looking into is the black box effect. So what does that mean? Most of the AI that is being trained at this point in time is based on algorithms which are known as deep learning algorithms. And these deep learning algorithms, how they make decisions, sometimes researchers even don't know that. And that's why we call it the black box. So another thing that can also seep into the AI training is biases, gender biases, or race biases. We know this for a fact, that insurance companies tend to reject insurance claims made by black individuals because they know that they are more prone to either diseases because of their socioeconomic statuses or their habits, etc. And so these are the different challenges that are going to come in, and this is just the tip of the iceberg. These challenges are very profound and deep, and these are something that we need to also talk about. Thank you very much.
Thank you, Dr. Fahad. Now I'm going to ask Samir the same question. Will artificial intelligence improve patient diagnosis?
Absolutely. Artificial intelligence has the potential to greatly improve patient diagnosis. AI algorithms can analyze vast amounts of medical data, detect patterns, and provide insights to assist doctors in making more accurate and timely diagnoses. This can lead to better patient outcomes and more efficient healthcare delivery.
All right, so even Samir thinks the same. Yes, Dr. Solit.
I just want to extrapolate what the ethics question was. What about the ethics? Now, there are issues, okay? All of you know it, that there are going to be issues about the data, the privacy, there's no human touch. What about somebody else getting to know it, the insurance companies and all of this? But in my lifetime, I have seen another totally life-changing thing which happened in medicine, which human beings were able to control it ethically, and that was cloning. I don't know how many of you were there when in the 90s there were clones. So you could make sheep, you could make monkeys, you could even, people were talking about making human beings. And then the whole world came together and said, enough is enough. We can't clone animals and live human beings and stuff like that. So the humans did come together, human beings, and we came up with a plan that this was unethical and we should put a stop to it. So same with an AI, there will be limits. until those limits are crossed, I think the AI is beautiful. Once those limits are crossed, everything else is not good. And I think it's true for everything in life. So I think we should give AI a chance and have its limits.
Thank you, Dr. Solat. Now I'm going to take the response from Samir. Will artificial intelligence compromise patient data?
As an AI avatar, I prioritize data privacy and security. However, like any technology, there is always a potential risk of data compromise. It is crucial for organizations to implement robust security measures to protect patient data when utilizing AI. Rest assured, ethical practices and regulations are in place to safeguard patient confidentiality.
Thank you, Samir. Now, Dr. Sara, I would like to ask you a question, which is more about how, since you are talking about an outreach program through your app, how can you gather information about epidemics, pandemics, and especially viral infections such as the polio virus, and how will your platform help governments reach places where they are unable to do now and provide treatment and eradicate such diseases from our country? Okay. So I'll throw this question to any of you. Yes. Yes, so my question is that how can artificial intelligence and a platform like Sehat Kahani help governments determine the way forward to eradicate viral infections like polio?
I think the example that I alluded to earlier was that we need to figure out what the hotspots are. And sometimes we are not able to recognize patterns based on our intelligence. And AI, using their unique different kinds of algorithms, is able to recognize different patterns which are unique and which are sometimes not understandable for us. So the next outbreak, for example, if it's coming, we'd know. Likewise, so I'm going to give you an example in which they were doing COVID-19 research, and in terms of doing COVID-19 research, they wanted to do a trial and wanted to find out which vaccine works best in COVID-19 patients. So they wanted to know which was going to be the next hotspot where the next outbreak is going to be. So based on collecting data from previous outbreaks, they were able to predict the next hotspot. And therefore, the vaccine trials were actually catalyzed in a way based on AI algorithms making a prediction. So next outbreak is going to be in South America. So the company actually looked for the location where they're going to do the trial and were able to set it up beforehand. So definitely there is a lot of, there is value of using AI in doing these kinds of predictions.
Thank you, Dr. Fahad. So now I would like to ask Dr. Solat, is there any example of artificial intelligence success story that exists today? And will this case study or example that you're going to share with us be accessible to people in Pakistan in the near future?
At this point in time, I can only tell you that the first three examples that I gave you, the ECG, looking at heart failures, which is applicable in Pakistan, the one that we can predict 12 hours before if the kid is going to not do bad in cardiac surgery, and that IVUS, the intravascular ultrasound that is there. All of this is available in Pakistan. If you're talking about general masses, like talking about all the setups everywhere in Pakistan, right now I think we are far behind. We have too many other issues going on to actually talk about an AI, but it is coming, it is there. But at this point in time, for the regular public, for regular hospitals, for regular stuff, that AI in healthcare is kind of a little far-fetched at this point in time, but not too far-fetched. Now, if you look at your phones, they are smartphones. If you have an internet and you may be in the middle of nowhere, maybe in Chaman, you can video WhatsApp or FaceTime or whatever you can do, you can have an access to a doctor. That's the digitization. That's what is going on in Pakistan right now. But as far as an AI support is concerned for the rest of the country right now, I think we are a little far behind.
Gigi.
I think Dr. Solis hit the nail on the head right with his comments. Most of the AI algorithms that we see in the market, or actually we don't see much in the market because they're not deployed mostly. They are usually proofs of concepts in which they do something very narrow, task specific and focused. Our group is working on developing an AI algorithm which will be looking at dental x-rays and making decisions in terms of finding out where different diseases are in general x-rays. So we've achieved a little bit of success in that, and hopefully we'll be rolling something out by the end of 2024.
Thank you, Dr. Fahad. So with that, I want to ask you that what challenges do you foresee in the near future? Because if you say that the students who are currently enrolled in the medical colleges, who are going to enter the future healthcare system, and if they're not being prepared for it, how are they going to cope with it? And are we ready to deal with such an environment?
Should I take this? Okay. So I think most of our students in this day and age, which is the Gen Z group, born after 2000, they're extremely smart, smarter than I was ever at their age, or any one of us. So I think we underestimate our youth. They're extremely smart. The internet has influenced them a lot. They are already being bombarded with so much AI information that we can't keep them away from it. So they're already prepared to learn the AI. They are already there. So you can't hide that from them. So when they come to the medical colleges, when they come to the medical staff, they're already using the AI. They are already using the AI in our medical college and all the medical colleges that I know of. How do they use the AI? When I was a medical student, I had to do a research. So let's say I wanted to put up a paper, and I had to go to the library and I had to review the literature. It would take me 20 days, just review 50, 60, 70 papers over a period of 20, 30 days. Because I had to get the books, I have to grab the library and do it. They can do it in seconds. The AI has helped them to generate the response of the literature within seconds. So instead of spending time on that, what they do, and even on statistics, the AI can give you the statistics also very well, or not AI, but basically the machines. But with the AI, they get the research. Now, with all of that already in place, they can actually focus more on actual research, what they were trying to do, like finding out a molecule in a virus, or a molecule in something, or a vaccine for virus. They would rather focus on that rather than trying to figure out what has happened in the last 30 years and doing it. So the AI has helped them. I think the medical students are already in place. They are already learning it. If some of the medical students are not learning it, they would be far behind, but I don't think there would be many. Most of the medical colleges are actually helping the students to learn these AI tools. And I would suggest, if somebody is here as a medical doctor and is participating in colleges, you should facilitate all your medical students learning AIs.
Thank you, Dr. Solat. So now we are beginning with questions from our audience. And the first question is for you. And then I would like to ask Dr. Sara a question once you've answered this. So what is the role of lifestyle in making changes to improve the data of disease identified by AI at birth?
Wow. So let's say somebody has a genetic profile, but it will happen. And at the time of birth, you take them to a geneticist, and the doctor says that by age of 20, he is going to have something called a hypertrophic obstructive cardiomyopathy. That's called HOCM. That's the commonest disease in which, when young students or young athletes are running, they just suddenly collapse and then they go away. So how come? So they are able to diagnose that right at birth. So by the age of 12 or 13, you would tell them not to participate in certain strenuous activities and not identify that at that time and rather get serial echoes. So that's one way. Diabetes, hypertension, coronary artery disease, you will change the lifestyle. If you're supposed to have a premature atherosclerotic heart disease at the age of 27 and you will end up with an angioplasty at the age of 28, you would change your lifestyle. You should not start smoking at the age of 18. So I think it will remarkably change it. It will remarkably change how your lifestyle will be. Let me give you an ethical dilemma to all of you. You don't have to answer it. Think about it when you guys go home. When we can identify this at birth in the next a year or 2 years, what if people are able to diagnose this before birth? Would they let the baby go? Don't have to answer this. This is the ethical dilemma which has come up with an AI in medicine.
Thank you so much, Dr. Sola. It's so interesting. I mean, there's a lot of food for thought for all of us. So now, Dr. Sara, an audience question for you. How can AI help reduce healthcare costs and improve access to medical services?
So apologies for the connectivity issues that we've been facing today, but I'll just take a little bit of time to touch upon 3 important things that I want to touch on since I do have the audience now, and answer this question as well. I think what it does, and any kind of technology, including AI or digitization, because I feel that it has to be talked about together, because one connects to another. I think what we've seen is it reduces the barrier of first geography. Because there's a lot of disparity on what kind of patients can access what kind of healthcare based on where they can access the healthcare from. There's also a disparity in gender. So even in our own country, women are not able to access the same kind of health services as men do because they're not able to leave their houses without a chaperone, as per se. It reduces the barrier of affordability. So when you walk into tertiary care hospitals, if you walk into a public health hospital versus a private healthcare hospital, the cost of care is very different. Now, unfortunately, in Pakistan, healthcare generally starts at a tertiary healthcare level. In most cases, it should not. It should start from a primary and then go to a secondary and go to a tertiary care level. But because, unfortunately, we don't have a lot of doctors, quality healthcare staff, appropriate infrastructure available in primary and secondary care, people crowd tertiary care hospitals, which overburdens tertiary care hospitals and reduces the quality of care. So I think for me, AI enables or digitization enables prevention and primordial healthcare starting at a basic healthcare level. So it reduces the number of people who will actually go from a primary care disease to a secondary care to a tertiary care disease. And it then increases a chain of people that can be helped earlier and their diseases can be cured earlier, and only a limited set number of patients go into those hospitals who seek proper care, and their affordability challenges can be addressed. If you take any public or private healthcare program, so we work very closely with insurance, and insurance all over the world wants to reduce their claim ratios. But one very big issue is because people don't take care of their health or they don't have models available to prevent them from getting chronic diseases, a lot of patients end up tertiary care hospitals and raise claims. Our own public healthcare program for universal healthcare is also going through trouble because of that, where there are increased claims because everyone is landing in a hospital. So I believe that the most important feature of AI, in my perspective, is prevention, is seeking diagnosis earlier, is seeking clarity of treatment earlier, is seeking a referral earlier, and change the quality of life that you have. So a loved one of mine, and when Dr. Solis was speaking, I could relate to it, that a loved one of mine got his first heart attack at the age of 40, and he was one of the 2 people who survived. But since that time, as a family, we went through 30 years of facing a cardiac disease that could have been helped if he just had a test or a consultation at the age of 30. So I think it really has impact on your life, on your relationships, on your bonding, and creating that technological shift in healthcare can really help a patient's quality of life and help them live longer and live with good quality health. I think one ethical concern that I just wanted to mention, and I don't want to repeat it again, is where does AI stop and where does physical intervention start? Because there's a lot of data that you can extrapolate and a lot of standardization that you can do. But then when decision making is involved, there should be a limitation on where and there should be some guidelines on where you stop with the intervention and you seek human expertise or human intellectual ability and emotional intelligence to solve that query for a patient.
Thank you, Dr. Sara. So our last question from the audience for Dr. Fahad. The question is, what regulations and guidelines are in place to govern the use of AI? So this is the question, but I'd like to add to it. Are there any regulations?
Again, very interesting question, and I think something to dwell upon. When we look at the West, there are certain regulations. It starts with the data. So it's not easy to transfer one's data to the other place without seeking consent. There are HIPAA guidelines which protect the patient's rights. Likewise, if you come up with a software, this software is treated as software as a medical device and would require FDA approval, goes through a bunch of different phases in which this needs to be tested, just like a medicine would be. But unfortunately, no such guidelines or regulations are available to us. Recently, there was a document that was made for guidance in AI, but no healthcare researcher or healthcare provider was part of making that document, so that's the sad part. And these are the things that we also need to talk about.
Thank you so much, Dr. Fahad. Thank you, Dr. Sara. Thank you, Dr. Solet. I think this was an interesting session. A lot of ideas that have been discussed here. We are going home with a lot of things on our mind about how to get a quick diagnosis and fix ourselves. And so I'd just like to sum up that the integration of artificial intelligence in healthcare is a promising path and can definitely improve patient outcomes and provide more personalized treatment plans. Do you agree? We'll be able to have more personalized plans, and the AI will control when we need to see a doctor and we can't delay it. So maybe that's another thing that it'll do. And as we move forward, it's crucial to strike a balance between harnessing the potential of artificial intelligence and addressing the challenges it presents. Thank you very much, everyone. Thank you to the organizers. Thank you to our sponsors. Thank you to our esteemed panelists, Dr. Solet, Dr. Fahad, Dr. Sara, and Samir, for giving us so many insights into the
Thanks
future
for
of
stopping
healthcare.
by.
Thank you. How did he go?